Public health, yeah.
Hey, what's up? Hello, everyone, and welcome back to another episode of SimplyPodLogical, a Simply Logical podcast. Today, we're doing something a little bit different through some of our friends at YouTube. Today, we have the opportunity to talk to the Deputy Chief Public Health Officer of Canada, Dr. Howard Njoo.
Fancy.
Mm-hmm.
So this is really exciting. It's our first guest ever on our podcast, so no pressure. But I'll just like to give a quick bio of Dr. Njoo because you guys out there, you know, we live in Canada, obviously. So Dr. Njoo is an important government figure for public health here in Canada. We see him on the TV pretty much every day when we tune into press conferences. But I'll just read a little bit of his bio to give you some background. So Dr. Njoo is the Deputy Chief Public Health Officer at the Public Health Agency of Canada. He's a federal government employee who directly supports the Chief Public Health Officer in providing public health advice to Canadians. In addition to just working for the government, he's also worked as a public health physician, a medical epidemiologist, and a frontline clinician in infectious diseases for almost 30 years. He's been involved in the Government of Canada's response to outbreaks before, like SARS in 2003 and the H1N1 in 2009, as well as some international experience advising Guinea after the Ebola outbreak in 2015. So that's just like 10% of his resume.
Yeah, I think we get the point. He's got a very long, impressive resume, and we very much appreciate that he was able to make a little bit of time for us today so he can maybe reach a bit of an audience online that might not be tuning in to these press conferences on Parliament Hill. So yeah, without further ado, here's the interview with Dr. Njoo.
All right, so here with us today is Dr. Njoo, the Deputy Chief Public Health Officer of Canada. And we are so grateful that you made the time to talk to us today. So I'm going to get right into the questions because I know you're a very busy man. Could you explain your role as the Deputy Chief Public Health Officer of Canada and what a typical day looks like for you right now?
Wow, that's an interesting question. So as a Deputy Chief Public Health Officer, I obviously support Dr. Theresa Tam, who is the Chief Public Health Officer of Canada. So I would say that the two of us were the lead public health technical experts at the Public Health Agency of Canada, which is the lead federal department or agency for the federal government in public health. But we recognize that we need to work closely with what we call our counterparts in the provinces and territories, the Chief Medical Officers of Health. So in terms of public health in Canada, it's a small community. We're very connected. We have lots of interaction. And so certainly dealing with COVID-19 and other public health issues, I see our primary role as the federal government is to basically be a bit of a coordinator to bring the provinces and territories together and make sure that whatever we do across Canada is at the end of the day, what we say, a coherent response so that the average Canadian sees it as a seamless approach and doesn't really see it as much of a difference between what the federal government does and what the provinces and territories do.
Yeah, exactly. We all want to be on the same page, right?
Exactly.
So how does a typical day right now for you look different than to, say, 3 months ago?
Wow. It seems like a lifetime ago. I think we started this back in January. So things have obviously evolved, but I would say that right now, my typical day, if I were to look at it, starts probably about 8 o'clock in the morning. We have a regular teleconference, Dr. Tam, myself, and other key officials here in Health Canada and Public Health Agency of Canada with our own federal health minister. So we give her an update in terms of what's been happening across the country in terms of the latest epidemiological data, the case counts, what some of the key issues are in terms of outbreaks and what might be happening in British Columbia compared to Quebec. Then obviously we give her an update in terms of some of the activities that we're involved in. For example, dealing with the scientists. What is the latest research findings? What are we doing in terms of developing guidance to help the frontline workers? Then obviously we also get her input in terms of what she sees as important issues that she would like to focus on and also be prepared for. And then we take all that and then it becomes a series of teleconferences. After our teleconference with the minister, we have a teleconference with all of the key officials here at the Public Health Agency of Canada. make sure that our battle rhythm, if you can call it that, for the day is well set. Everyone knows who's in charge of what, who needs to deal with a certain issue and come back and bring sort of a progress report back to the other people at the table, so that we're all coordinated for what we need to do during the day. After that, obviously, Dr. Tam and myself, we look at the latest reports, get all the input from various staff members in terms of what are the hot issues, what we need to be prepared for. Because as you may have noticed, we do a daily press conferences now. It's always noon Ottawa time every day. And so we need to prepare, and obviously then go up or to Parliament Hill, go into the special room, sometimes joined by ministers, and we do our thing in terms of giving Canadians an update in terms of what's happening across Canada, what we see as some of the key issues. We've been, I think, probably maybe to a fault, sort of underlining the key messages to all Canadians, what they can do, what they should do to help deal with COVID-19. Everything from individual things such as obviously good hand washing, good what we call cough etiquette, maintaining that what we call social distancing or physical distancing of 2 meters apart, stay in your bubble. All those things are so important. And what we also hope to do, and we're starting to see some evidence, is that these efforts are paying off in terms of what we call flattening the curve. And we can talk more about that, what that means. And so that's what we do from about noon to about 1 o'clock. After that, we both come back to the office. And then it's all the real hard work behind the scenes. So we have daily calls with all of our provincial and territorial counterparts, the chief medical officers of health. We talk about their hot issues. We exchange information. We look at the kinds of things that we need to focus on, what might be happening down the road, or what people see as potential things that we need to deal with. And then we obviously talk to our technical staff in terms of pieces of work that they need to work on. And then these teleconferences and the work actually continues into the afternoon and even to the evenings. Often we're on teleconferences well into the evening. And then the next morning, depending on sort of
it doesn't start over again.
Yeah, I'm exhausted
starts
already.
over, and then sometimes we even have what we call international calls, because we keep a close eye on what's happening internationally. And for example, there might be a call that's convened by the World Health Organization, and that's a challenge because I think the best time that's worked for everyone is that the WHO might organize a call that's, I think, about 2 o'clock in the afternoon their time, which would be 8 o'clock in the morning our time, which means who knows what time it is in other parts of the world. And same thing. It's one of those things where international collaboration is so key in terms of exchanging our experiences, best practices, what's been happening with the science and so on. So at the end of the day, hopefully it really is a coordinated global effort to deal with COVID-19.
So it sounds like a record number of really important meetings is what your
for
day
sure.
is like.
For sure.
Yeah.
So today you're reaching a different type of audience than the one you reach like daily with Canadian television updates, which Ben and I watch also. So we appreciate that. We see you on TV every day. But today on YouTube, you're reaching a different audience that may not necessarily be tuning in to the daily press conferences that are happening on Parliament Hill. It's likely a bit of a younger audience. So what is the main message you think that young people need to hear right now from a public health perspective? And are young Canadian adults and teenagers getting the message?
Well, I think the key message we want to give to everyone is that, wow, this really is a serious thing. It's something that certainly in my whole career, 30 years plus, haven't seen. I think lots of other people around the world have never seen anything like this. The fact is that we're dealing with a completely new virus. And what does that mean? Well, that means that no one in the world, or at least at the beginning of all of this, had any sort of protection or immunity, natural sort of a defense against this virus. Everyone was equally susceptible as compared to many other infectious diseases where, for example, seasonal flu, certain people might have been exposed to a similar strain the year before, et cetera, and therefore not be as susceptible. Plus, we do have what we call vaccines and other treatments against seasonal flu. For this new virus, completely new, no one in the world was prepared for it, and you can just see how devastating it's been. If you look at countries around the world as the virus basically sort of propagated around the world, countries in terms of the number of cases, and also obviously hospitalizations, and unfortunately a lot of deaths, certainly was sobering. And we were, I think, somewhat lucky in Canada. We were able to see what happened in China, and then obviously in Europe, countries like Italy and Spain, and that helped us also prepare for what we could be facing in Canada. So I think certainly, I think that the key message is that, wow, we have to take this seriously. And because it's such a new virus and we don't have vaccines or treatments, the only thing we can do is what's always been shown to be effective for what we call respiratory infectious diseases. And that's good sort of a personal hygiene. So that's a constant hand washing, because that's how the virus gets transferred, is by coming in contact with your hands. And then if you touch your, let's say your eyes or your nose or your mouth, that's how it gets introduced into your body. Good cough etiquette, because if you do cough and you're infected, that's how you spread the virus through respiratory droplets. And then, of course, the famous social distancing. And people ask me, okay, so where is the social distancing 2 meters comes from? And they say, well, it sounds kind of gross, but scientists have done experiments with special lighting, etc., looking at people when they do have infections, coughing, etc. And then you can see with these sort of time-lapse photographs how far the spray from respiratory droplets from someone's mouth actually can travel. And it's been determined it can actually travel quite a distance, up to 2 meters. And that's why the 2 meters or 6 feet comes from, where, okay, if someone wasn't really sort of doing the best in terms of cough etiquette, like coughing into their sleeve or into a tissue paper, then definitely by keeping a distance of 2 meters, and if someone were to cough, you would be fairly safe to not get exposed to their respiratory droplets. So that's a key message. And as I said, it's something that I think everyone needs to take seriously, because that's the only, I say, measures we have, the social distancing and the good hygiene, etc. While obviously our scientists and researchers around the world are furiously working to try and develop treatments and a vaccine against this virus.
So I wonder then if you could clarify, I think there's still this conception or misconception out there that this is like an old people disease, and that really it's only elderly populations that are at risk. I think in Canada, we've heard a lot about elderly populations in these nursing homes and how that's been a huge problem. But I'm wondering if you could clarify to what extent we've seen younger Canadians who have both gotten sick or required hospitalization.
Well, that's a very good point, because as I said before, everyone's equally susceptible to becoming infected. In terms of who actually has a higher chance of becoming quite sick and needing hospitalization, it is true if you look at the statistics that older people, but also I would say anyone with what we call an underlying medical condition, if you've got some condition where your immune system isn't working as well as it could or should be, then obviously you would have a greater chance of what we call having complications if you were to become infected. But what's I think interesting about this virus is that it really it doesn't discriminate. And many young people, and I've seen stories of young people in good health, even athletes who exercise regularly, etc., good cardiovascular capacity, they've been hit quite hard. So it's sometimes something that you can't always predict, because some people, the way their body reacts to a virus may be completely different. It has nothing to do with their, quote, what we call prior health condition or medical condition. And so I would say that there's actually about, I would say, 30% of all of our cases are actually under the age of 40. So that's quite a significant percentage of people overall who have the infection. The other part I think that's kind of scary is that I would call this a very sneaky virus. In some ways, some viruses like you see in the movies, are so deadly that everyone that comes in contact with it ends up dying. So it's easy sort of to look at the trail and go, oh yeah, so-and-so was in touch with so-and-so because look at them. They all ended up dying. But what's happening here with... Sorry?
I saw Contagion.
Exactly. That's one of my favorite films, by the way. But in this case, what's happening is that there are some people, many people, who actually might have what we call mild infection, maybe just a bit of a runny nose and cough, and not even be aware that they have COVID-19. And that's the scary part, because they unknowingly have obviously passed it on to others who then might be the ones at risk of developing more serious complications. And that's why this virus has really spread so rapidly, I would say, because of this element where individuals who might have mild symptoms and not really be aware, and only maybe in sort of hindsight recognize, oh, I probably had COVID-19, have passed it on to others. And so I think it would be really sad, and it has happened, where, for example, maybe younger people or folks who maybe haven't really suffered from the infection have then gone to maybe visit, for example, their grandmother in a long-term care facility. And that's how, in many cases here in Canada, it got introduced in terms of those what we call high-risk settings, where a lot of older folks, who obviously then would be at a more serious risk of getting complications, have become infected. And in those settings, it's challenging. You know, there are a lot of people living sometimes more than two to a room, etc. And with the personnel also having to deal with multiple residents, you can see there's been quite a few outbreaks in what we call long-term care facilities.
And then I'm also wondering about like this sort of secondary effects in terms of there's going to be a lot of young people out there who probably won't get the virus or be infected, but this could very likely become like the defining moment of their childhood. Maybe they were supposed to graduate high school and they weren't at school anymore, or they're just leaving university and they should be entering the job market. I guess I'm wondering to what extent, from a public health perspective, you consider or could offer any advice or insight or perhaps even resources for people who might be feeling the mental health consequences and not just the physical health consequences of this social or physical distancing.
Yeah, well, first thing I would say that, yeah, even at a personal level, I can appreciate that, because I do a bit of a shout out. My second son was actually due to graduate from engineering from university, and certainly his graduation ceremony compared to his brother, that's certainly not going to happen in the same way. Who knows what's going to happen in the future? So certainly recognize that for a lot of young people, milestones in their life that they might have anticipated, you know, the prom and so on, aren't going to happen in the way that it would have happened without COVID-19. I think at the end of the day, I think what all people recognize is that the most important things really in life are not money and things like that, material things. It's really your health and family and friends. So I think in my sort of personal view, that's what we need to focus on. So the first one, in terms of your health, as you were mentioning, in my mind, when I look at health, I think of sort of not just our physical health, but also mental health and sort of spiritual well-being. And so from the mental health, I would say it's not just mental health per se, but how it relates to the other two aspects. So there are lots of resources out there. I think many people might be feeling sort of isolated, lonely. Certainly, I would say the government of Canada, we have a nice app called COVID-19. There's lots of resources you can tap into on the app in terms of finding connections, a wellness portal, how to connect to other people you can talk to, etc. There's lots of resources, I think, also on the internet in terms of looking at our website, but also other, I would say, trusted sites in terms of looking at resources. I would say even in your own community, I think many local governments and other sectors are looking for ways to reach out to their clientele or populations and individuals in need. So on the mental health side, that's in terms of resources that the people could avail themselves of. I think also for mental health, in terms of just trying to keep yourself sharp, right? There's lots of great things on the internet. You know, I look at YouTube videos, you know, taking cooking lessons, learning another language, you know, playing games, etc. Those are all the kind of things that you can keep yourself sharp mentally. And then, of course, physically, you know, you can also then do exercises, you know, do some yoga, etc., looking at various things on the internet. So I think there's lots out there. And I think people certainly should take advantage of that. And as I mentioned before, besides obviously your mental health and physical well-being personally, in terms of your health, reach out to your family and friends in terms of having maybe a regular sort of a get-together virtually over coffee. What's kind of interesting is that even for myself, I find that because of this, in some ways, life has slowed down for a lot of people. So I could tell you, I have one brother who actually lives in Europe. He lives in Paris, and because of the sort of the time zone difference, normally I wouldn't really have a chance to chat with him, where everyone's so busy running around their lives. But because he's in sort of isolation in Paris, they're sort of locked down as well. And the same here in Canada. We actually made a point to do a virtual Easter. So we got together sort of a 3-4-way call with my sons in Montreal, my daughter in Ottawa, obviously my wife and myself here in Ottawa, and then my brother and his family in Paris. And we had a great chat over Easter. So I think that's so important. And of course, beyond family, I think connecting with friends in terms of looking at doing a virtual book club, a whole bunch of different things people can think of. And I've been impressed by the creativity as shown on the internet in terms of people putting various things out there.
I think we're just old enough to remember life before the internet, so I couldn't imagine going through this without having that resource and that way of still connecting to people. So.
And yeah, you're right. It's like now, given the times, we don't have to make time to connect. We have the time to connect, so we should kind of use that to our advantage. So I think the question at the top of a lot of people's minds is, how long should we expect this to last? And can we reasonably expect some of these social distancing measures to be lifted? Now, rather than asking you for a specific date, which I know isn't reasonable, I'm more curious about what sort of data points or what key metrics do you want to see from a public health perspective before the Canadian government is actually in a position to decide whether or not we can relax physical distancing measures?
Well, you've heard the famous expression of flattening the curve. So before we talk about flattening the curve, there's something, it's interesting. I find a lot of people are now becoming, I think in a good way, amateur epidemiologists. Everyone understands what epidemiology is, or at least some of the basics, and in terms of what we call the epidemic curve. So I'm not sure if I have a slide here, but essentially what you do is that if you look at a graph and so-called, the vertical axis and your sort of a horizontal axis, along the vertical axis, what you would do is plot the number of cases, and then across the horizontal axis, it's over time, usually on a daily basis. So you could say, okay, on this day there were 20 cases, and the next day there was 30 cases, and you keep plotting that over time. And so that ends up being a bit of a curve. And of course, with this outbreak, at the beginning, there were very few cases in Canada. And then, of course, the cases kept going up and up and up and up and up. And now everyone's holding their breath. And because we've now put in all these good public health measures, and Canadians, by and large, have been great in terms of sacrificing a lot in their lives in terms of staying at home and social distancing and so on, we're actually starting to see the number of cases, as they say, remaining stable, or even in some cases going up and down a bit, but certainly not increasing very, I would say, exponentially as they were in the early part of the outbreak. So as a minimum, I would say we're starting to, quote, bend the curve. And so it remains to be seen if we're actually going to be flattening the curve. And what's really interesting is that you don't even know if you've actually, on the downside, if you've passed the peak until you're actually past the peak, right? Because if the cases are there, you have to actually look at least a few days of data to see if the trend of cases going down actually is there for quite a period of time to actually say, aha, the peak of cases happened, X number of days ago. So that's what everyone in Canada is looking at, but I wouldn't say it's looking at the national picture. At the end of the day, it's really what's happening in individual provinces and territories, and even in your own city or region, because Canada is a big country, and what's happening in one part of the country on the west coast of British Columbia might be a totally different reality compared to Quebec. So the other part also to note is that the data we're seeing, there's always a time delay. When you think about it, it's kind of interesting to think about because of the incubation period of the virus. And we all know now that if you get exposed to the virus, it could take up to 2 weeks before you actually develop symptoms. So let's say you develop symptoms after 10 days or so. You feel kind of crappy, okay, few days, okay, this is more than just a cold. You go and see a doctor. By the time you get maybe a laboratory test, it goes to the laboratory, the results come back. That could easily be 2-3 weeks. So actually, when you look at the epidemic curve from today, it's actually the result of what people have done up to 2 to 3 weeks ago. So that's why if you look at the curve now and say, oh, wow, we're doing well, you can't let go because you won't see the results of what you and everyone else is doing in the country, and hopefully in terms of keeping at it until 2-3 weeks down the road. So in terms of when the government or at a local level or at national level decides, okay, looks like the curve is starting to flatten out, maybe we can start loosening things. I think we all need to do this very, as they say, prudently and with a lot of caution, and look at what are some of the things that maybe we've seen in other countries now as they start to open certain businesses, schools, and so on, see how they're doing it, and then learn from them. We're a bit behind some of the countries in Europe and Asia, and I think we could learn from their experience. And so I think overall, I think everyone's on the same side. We're not going to do an on-off switch and say, okay, we're all going to like open everything all at the same time, but maybe stepwise. Maybe especially with our summer, look at a few things like what kind of outdoor activities might be reasonable in terms of social distancing. I could think of, for example, for myself, I love to hike, maybe a hiking with social distancing in our beautiful outdoor parks and so on might be something to consider. And that's might be one of the things that might be, as they say, open first. So that's sort of a bit of a sort of a short or maybe a long answer to your question.
No, it's detailed. Thank you.
Rely on the data, basically. And
Rely
we're not
on
in
the
the
data,
clear
for sure.
until we're in the clear. So.
And even when, let's say we did a few months from now relax some physical distancing measures, I imagine it would be very important to continue testing to make sure there isn't a spike after the fact. And actually, we had a question about testing more broadly as well. Right now, we're kind of under the impression, I mean, correct me if I'm wrong, but the testing seems to be mostly limited to people who are either symptomatic or who have reason to believe they came into contact with someone who had the virus. Is there any thought to expanding testing more broadly to the Canadian public? And what is like the barrier to doing that if we wanted to?
Okay, that's a very good question. So I would say to the first part of your question that you're right. If we start to relax the measures, or you say public health measures, and hopefully monitor, one of the key things we have to have in place is, as I maybe mentioned earlier, is a good surveillance system and lab testing to be able to detect. So if, let's say, for example, things go sideways and maybe we're getting more cases, we have to be as a country or a region, be able to rapidly detect if there are little outbreaks happening and then get right on in terms of isolating the cases, doing the contact tracing, etc. So you're right. Surveillance and lab testing is key. In terms of lab testing, that's a very interesting area to discuss because you're right. Certainly the priority, I think most people can appreciate it, is that obviously people who are sick with symptoms, etc., especially in high-risk settings, for example, in a long-term care facility or in a hospital, etc. If you're a worker or you're a patient, those people need to be tested. So the question comes, well, why don't we just test everybody? Well, the thing is, if we look at the test itself, it also depends on sort of what we call your viral load. So first of all, there could be people who might actually have been infected, but remember we talked about that incubation period, right? It could be up to 2 weeks before you actually develop symptoms. Usually it's about a week or so. So let's say you're early, you actually were exposed, you do have the virus, but you're still in your incubation period and you feel perfectly fine. If you were to get a laboratory test, what might well happen is that you get a negative result because your body is still, the virus is still replicating, but not to the point that there's enough virus to actually make the test turn positive. So you might get this false assurance that, oh, I'm negative, I don't have COVID-19, but you actually do. And then, 4 or 5 days later, you actually then develop the symptoms. And if we were to do a test then, you would turn out positive. So you can see that's a tricky part where you have to do the timing of the test at the right time when you have the biggest chance of actually getting a positive result. It doesn't make any sense to test everybody in Canada because you'll get a lot of what we call false negative results and sort of wasted resources for people who then might think, okay, that's fine, I've got a negative test result, and then later on you get it. And of course, the other part is that even if you have a test result that's negative and everything is good, that doesn't clear you. It just means that at that point in time, you haven't been exposed to the virus. But if you then suddenly go running around, being in contact with lots of other people and so on, you might well be exposed to the virus and still get infected.
Mm-hmm. It's not necessarily a marker of immunity or some kind of fast pass to go join the world as normal again. Right.
Well, that's the one kind of test that we're doing right now, which is called, not to get too technical, it's called PCR or molecular testing based on sort of the genome sequence of the virus. And what we're also developing now are other types of tests, such as what we call, hopefully in the near future, introducing point of care. So rather than having to take a sample from the patient and shipping it to a laboratory, and that obviously is I think more of a challenge for northern isolated communities where they don't have their own laboratory. They have to send it to a laboratory down south, a so-called point of care where it's, maybe a machine that's mobile. You can bring it up north and you can take a sample, then put it into the machine and get a result, in a very short period of time. That's what we're aiming for, and that hopefully will be coming out shortly with all of the research, etc., going on in a short period of time. And then I think, as you alluded to, another type of test down the road is what we call serological testing, which doesn't look at the virus sequence or genetic sequence, more about looking at what type of antibodies people have. And so if you've actually been infected, your body has an immune response and you would develop antibodies. And this other type of laboratory test might also then detect if you've had infection and now developed antibodies. The question then is, are these people immune? That's still evolving, and the science is not clear. Most infections, you might think, okay, once you've got a certain viral disease, you've got immunity for life. But this particular virus, pretty sneaky, and it's not sure that if you do have immunity, how long that lasts for. So those are all things that are still, as they say, in play as we continue to study and learn more about this virus.
So we don't know that yet, right?
No, at this point, we're still developing the test, but in terms of immunity, how long that lasts for and so on, we're also looking to the experiences of other countries. But at this point, we don't have enough evidence to declare and state categorically, yes, everyone's been infected, has immunity, and it's lifelong. Certainly not there yet.
Yeah, a lot of this is very scary and definitely like anxiety inducing, in the fact that there's so many unanswered questions. And we've been hearing from public health experts lately a lot about how things are just not going to go back to normal after this, and that there's going to be a new normal. What do you think that new normal looks like? And I'm thinking of the way people gather, like concerts or going to school or office places where there's, you know, more than 20 people in a room. Mm-hmm.
Wow, I don't know. That's a good question. I would think just from different perspectives, I would say that one of the things that certainly we've seen is that for businesses, even governments, how we work, because we have the technological tools, people can work virtually. So the so-called sort of the actual physical building where everyone has to go every day, commute to, and then work at their desk, and then hang around the water cooler. I think. We'll be seeing less and less of that, and people will be probably working in terms of hopefully still having that connectivity and that social aspect, which I think is important. I think you'll see more and more of that in terms of how businesses have their employees work. So that's one thing. I think in terms of hopefully down the road, if COVID-19 really isn't a public health issue, I think we will always need a bit of that sort of a social interaction. I think we're social beings, and I don't think you can have concerts and so on, and there's no one there, and you're only watching it online. This is for here and now, but who knows down the road. But certainly one of the other things I'm seeing now, and it's interesting, it's more of a cultural thing, is that, in Asia, it's always been sort of a normal practice, I can call it, maybe a sign of respect, that if you have a cold or infection and so on, you wear a face covering, not necessarily a medical mask, like, want to say the actual medical mask for healthcare workers and the frontline essential workers, but for the average person, if you have a cold, etc., and you're going out in public, you wear a face covering or sort of a non-medical mask, and that's always been, I think, a sort of part of the culture in Asia. But you can see here now it's coming over to sort of Europe and North America, because there is some evidence to show that some people who have maybe very mild symptoms, pre-symptomatic, etc., might also be contagious to others. So by wearing a so-called face covering or non-medical mask, it's not about you necessarily protecting yourself against others, but you actually sort of taking the initiative, hopefully that's showing the respect to others by protecting them by wearing that face covering. So should you in any way have a chance of transmitting the virus, you don't do that. So that's one of the things I can see maybe over time becomes part of the norm here as well, in terms of part of our normal thinking in terms of culture. Plus, I think also, I think more and more people just know a proper cough etiquette now, and hand washing and so on. Hopefully those things stay in place even after this COVID-19 pandemic is over.
Yeah, maybe no more shaking hands when we meet each other anymore.
Well, I know we're running really tight on time, we're short, so maybe we'll just ask one last question to end on a sort of a lighter note.
Okay.
We know you're very busy. We heard your schedule at the outset, but for those of us who are stuck at home and doing our best to maintain physical distancing and respecting this quarantine, could you recommend any binge-worthy TV shows or maybe YouTube channels we can watch?
Well, I'm going to date myself.
Who you subscribe to?
Well, I can say things that I've binged on in the past. All my friends, my family will laugh. People haven't seen it. Certainly, I binged on Breaking Bad. So if people haven't seen that, it's a great series. Game of Thrones. I think, as you mentioned earlier, some of the films, sort of the the outbreak type films, be it Contagion or even the older one. I'm dating myself, Outbreak, similar type of film. I think are quite interesting, and they're quite realistic. Same with, I think, Pandemic, which is on Netflix. So those are the kind of things I like to watch. Also concerts, music videos. I actually didn't have time to see the whole thing, but I did see the concert by all of these artists for, you know, the Global Citizen sort of event that was put on this past weekend. So that way I can sort of use my time most efficiently. So
what's your favorite movie about viruses?
Which one?
I would still have to say is Contagion. Contagion, I think, is pretty good because I can actually relate to sort of the characters, the epidemiologists, etc. Plus, also I can attest where they actually filmed it. I could actually say, yeah, that actually is the emergency room at the CDC. So I've been there, WHO, and so on. So yeah, they use real sites or rooms in buildings that I've been in with my international work.
So we could do research just by watching that movie.
Well,
I don't know.
Yeah, in some ways, I think the key message to me, I think there's also a bit of a ecological, environmental message about sort of the interplay between man and the environment, because we talk about zoonotic diseases and diseases which transfer between humans and animals, and vice versa.
And so the R-naught. I learned the R-naught.
R-naught, definitely, yes. So
something.
yeah, lots of good stuff to learn.
Yeah.
Well, hey, we appreciate so much you making the time to talk to us. We know how busy you are and how important your role is. And we just want to say thank you.
Thank you.
We see you every day on TV, and thank you, and also to the broader healthcare community. Yeah, just thank you so much to everyone doing their best to help us out right now. The least we could do is stay home and do our best not to help spread this. So
yeah,
it's been a pleasure.
Thank you so much. Yeah.
Well,
Hope
awesome.
you enjoyed the podcast, Dr.
Yeah.
Njoo.
Thank you so much, Dr. Njoo.
Okay,
take
bye-bye.
care.
Thanks. Bye.
Bye.
Well, that was fun. We interviewed an actual professional. That was our first guest on the podcast ever, and it's like the Deputy Chief of Health of Canada.
Yeah, if you had asked me 2 months ago who our first podcast guest would have been, I wouldn't have predicted
I would have said like Threadbanger, but nope, it's Dr. Njoo.
But yeah, we really should, you know, show our appreciation for Dr. Njoo and his staff for making this possible, and also our contacts at YouTube in the PR department, Maria, and then our main man, Francis, always looking out for us.
Thank you, YouTube, and the Public Health Agency of Canada for being willing to even entertain the idea of having one of their employees come on our YouTube podcast, right? That's a big step. So well, I really appreciate it.
It's important that governments recognize that a lot of people our age don't pay for cable anymore. They're not watching television, right? So yeah, I think there's an important point in that. A lot of people watching this are probably not going to be watching the daily press conferences being streamed on CPAC or CBC or public television, right?
Yeah, and I'll just clarify, it wasn't our day jobs that got us this hookup. It wasn't through that government. It was YouTube who asked us. Didn't even have a chance to sip my tea yet. I was so interested in Dr. Njoo.
He gave very detailed answers. We didn't even get to all the questions.
He's such a good speaker.
Prepared. Yeah, he's done this before.
Yeah, exactly.
Yeah, so another question we were going to ask him, but we didn't get the chance to, is there anything he thinks we and the general public can do to support healthcare workers in this time? Because they're risking so much, and, you know, they're risking so much to keep us safe, right? And we've been thinking about that lately as well.
We assume his answer would be stay home and, you know, follow the rules of physical distancing. But Ben and I were thinking of what else we could do beyond that to actually, you know, give some assistance where we can, because we are in the fortunate position to be able to. So
yeah, so we've seen actually quite a few YouTubers, I think, step up and do some interesting initiatives to help support people in need. So yeah, we had an idea, or we got this from someone else, but we wanted to do something to both help support the food industry in our community and also healthcare workers, because a lot of restaurants right now are going through a really hard time. Profit margins are already very thin, and all of a sudden people are being told not to go to restaurants, right? So we had the idea to do something that could both support a few local restaurants, but also help feed and take care of some of those frontline healthcare workers that are keeping us safe right now. So starting Thursday, April 23rd, we've reached out to 3 restaurants in Ottawa, and we're going to set up a $3,000 tab at those restaurants so that any healthcare practitioners, doctors, nurses, volunteers at testing facilities. They could come into those restaurants, and until that tab runs out, they can get their order for free. So the 3 restaurants are Burgers and Fries Forever in the Byward Market at 278 Dalhousie.
Nom, nom, nom.
Time and Again, they have locations on Carling Ave and Wellington in the west end of Ottawa. And Pure Kitchen, they have several locations across Ottawa. Yeah. So I just want to say a big thank you to those places for being willing to do this. And we should say we kind of have selfish reasons for doing this as well. We want to support those restaurants because we like those restaurants.
Because we like their food.
Yeah. Pure Kitchen is a great place to get vegan food that actually tastes good.
It is really good. Like, I love it.
Yeah.
And I usually eat chicken, but, you know, I'll eat at Pure Kitchen. It's so good.
Time and Again is a great place. It reminds me of, like, home cooking if your parent was actually a really good cook.
And that one of their locations is near our work, so it kind of makes me a bit nostalgic.
Yeah, we would go there for lunch.
We used to go there for lunch, during work.
And just so there is a bit more of guilty pleasure food on there, Burgers and Fries. We picked that restaurant because I actually went to high school with one of the owners of that restaurant.
Fun fact, I'm going to spill your past again. 6, 7, several years ago, before YouTube, you used to make ice cream sandwiches for Burgers and Fries Forever in our kitchen / their kitchen at one point.
No, I would go to their kitchen.
And you would do it all night. You'd be there like until 4 o'clock in the morning. Yeah,
so when they first opened their burger joint, the original location on Bank Street, I was basically like an independent contractor who would come in and make like ice cream sandwiches, desserts for them.
First you were a Donkey Kong top star, and then you were an ice cream sandwich maker.
You know, I was just seeing what I like doing.
How come you didn't include that in our jobs podcast?
Yeah,
about
I
your
never
ice
talked
cream
about
making
it.
history.
It was more of a passion than a job. But also, I want to give credit to these restaurants, not only for the willingness to do this, but all of them were already doing something to support our local community before we even reached out.
Yeah, we Googled it just to see like who to contact, and then most of them already had something set up to help healthcare workers.
And I think that's a pretty amazing thing considering what position we know the restaurant industry is in, to see that these places were already, Time and Again they have a soup program where they've been helping feed vulnerable members of our community for a while now. Pure Kitchen has been delivering brown bag lunches already to hospital workers and different healthcare facilities. And BFF, they're just reopening now, but they've already announced that they're going to be donating all of their profits, if they have any for the time being, to first responders. So
this is so exciting.
I just think it's a pretty amazing thing.
So if you're, just for clarity, if you're local here in Ottawa and you're a healthcare worker and you would like some food from Burgers and Fries Forever, Pure Kitchen, or Time and Again, just call them up and say you're a healthcare worker and you want to take from the SimplyPodLogical tab.
Yeah, we'd only ask that if you are a group or if it's a larger order, please get in touch with them directly in advance and make some arrangements for that. Obviously, we want to maintain physical distancing too, right? So it's not like groups should be showing up, but we also don't want to just show up and surprise them with giant orders.
Yeah, so maybe call in advance, but just take it off my tab, you know? Happy to support. So that's really fun. We've never done that before. I'm excited. Maybe we could go get some food too, but reserve it for the healthcare workers.
Yeah,
we'll make a separate tab for us.
We'll put details on the restaurants and the specific promotions and how to claim it and who's eligible down below, and we'll be posting some stuff on Instagram about this too for details.
In the YouTube video description box,
Well, Simply, I think that's it.
Yeah, I hope everyone's doing okay. I know this was kind of a heavy topic and maybe not that expected to see a public health official talk about, safety of the virus on this channel. But I think it's a good time to do this, and we're just really fortunate and excited to have that opportunity. And practicing interviewing people is something I should probably do. So
I also think it was a cool opportunity to have more of a conversational exchange with a public health expert. I think we've seen a lot of these people on television having these brief, 1-minute targeted questions from these very established media sources, but to actually just talk to Dr. Njoo like he's a human being and ask him what TV shows he likes and stuff, I think very much humanizes the response to this. And also I think we recognize there was an opportunity to ask some questions on behalf of some of the younger people who are probably watching this, that probably aren't necessarily being represented in terms of the traditional media questions being asked of these people at press conferences. So yeah, hopefully that was interesting. We'll be back next week, next Taco Tuesday with a regularly scheduled program.
Today's Taco Thursday. Apologies for this slight delay. But next week, we'll be back to regular Taco Tuesday with a podcast on cats.
Yeah.
Cats. Yes.
Okay.
I'm so excited.
All right. Apologies to Jenna Marbles today. We were supposed to have her on, but she
Jenna?
got bumped by Dr. Njoo. Yeah.
Sorry, Jenna. We just had to have the doctor.
I know she was really busy. I think she has a basketball game tomorrow, so she already was a bit tight on time.
Ben, that was like 2 years ago. Her basketball
we'll have her
game.
on another time. But thank you so much for watching, everyone.
I hope everyone's doing well.
Stay safe. Wash your hands.
Jinx.
Yeah. Cough into your elbow. Do all those things. But
practice physical distancing, which isn't necessarily social distancing, because you can, go on your computer, FaceTime your friend, do a little TikTok.
Do a
little TikTok. I don't know, TikTok.
All right, keep on TikToking, everybody. We'll see y'all later.
Thanks so much for watching. We'll see y'all later.
Bye. Bye.